Hello, everyone. It's Monday, May 16th. We have good news, surely really tough news on these families, and I want you to remember them. And we have two losses or two deaths since the last time we were together, and I'm sure that there's maybe some lag over the weekend and all that, but these they're telling me these are absolutely two different individuals. They're the same age, from the same county, the same sex. The 6,894th death is a 74-year-old female from Berkeley County. 6,895th death is a 75-year-old female from Berkeley County. I hope I said that right on the first one. I'm going to do them again. The 6,894th death is a 75-year-old female from Berkeley County. And the second death is a 6,895th death, is a 75-year-old female from Berkeley County. These families are hurting, and their loved ones are hurting. And I ask for the prayers for these great, great, great ladies that we lost, all the wisdom, all the goodness that they've given each and every one of us. We're up to 1,964 active cases in West Virginia now. It just keeps bumping up, bumping up, and bumping up. We have 1,305 new cases in the last 24 hours. Our daily positivity rate is 11.58%. Our cumulative stays about the same because it doesn't move but very slowly, 8.10. We have 497,974 people that have recovered in West Virginia from this dreaded pandemic. We have 129 folks that are now hospitalized, 24 in the ICU units and 11 on ventilators. And we have 29 green counties and 26 yellow counties in West Virginia. Anybody can look at this and see that our numbers are going up. I watched a broadcast earlier this morning, very early this morning, and they said basically the CDC is predicting the next couple of months to be pretty good months, some pretty slow months and everything. So we're really looking at June, July for this thing to not be aggressively moving up, but it's moving up in West Virginia. And that could very well be a backlog or could whatever it may be, but the bottom line to the whole thing is one thing. And I don't know how many times I got to say the exact same thing. But the bottom line, without any doubt, is we got to live with this. We can live with it. It can absolutely be managed. The way to manage it, the way to live with it is booster shots, vaccinations. Stay on top of your game. Use absolutely our calculator, that we have that you have up there that is going to notify you as to when to get your shots and everything. Absolutely, without any question, the way to live with this dreaded killer is to absolutely manage it. Manage it. And to be able to do that, you need to absolutely be getting your booster shots, getting your vaccines. That's my opinion. Without any question, more and more and more people are going to die, and we can make it less and less and less. Without any question whatsoever, I don't think this thing's going to leave. I don't think this thing is just miraculously going to evaporate. I think we have to find a way to live with this. And if you believe in the words that I'm telling you, and I promise you, with all in me, all I have done is tell you the truth. The good and the bad, I have told you absolutely the truth all the time. I believe, Jim Justice believes, this thing's not going to go away. And if it's not going to go away, then how do we handle it? We live with it. We find a way, just like we have lots and lots and lots of dreaded diseases throughout all of our past, we found a way to live with it. We can do that with this as well. There's no need me going back through all the booster information. I've already just been through that. I feel like I'm, at times I'm either preaching to the choir people really believe or barking at the moon. But in that, you and I both know that we can absolutely accurately measure how many people have gotten their first shot in the last few days or the last 30 days. It's substantial. And so we want to all continue to try to encourage everyone we can to get those shots. And be respectful, Be super respectful of people's freedoms and their choice, because that's what's made us really great in this country. But encourage, please encourage. As far as the vaccine distribution update and everything, we're at, the numbers continue to just barely move to a positive, in a positive way. We're still at 90.9%. I'd like us to hit 91 and then just keep on moving on the 65 and olders. But everything that we have in us tells us this disease attacks predominantly the older folks. Those are the most susceptible. And with all of that, the 50 and olders, you've got to get your shots and you've got to get that booster shot. Like I said, the vaccine calculator's up. It gives information on when to get your next shot. All the other information on our vaccine info line is up. Take advantage of the free testing. We have 39 outbreaks in our long-term care facilities, none in our church community, 16 inmates and 18 staff cases now. It worries me when the staff cases start up and everything, because the staff members are the ones that are going in and out and everything, and could very well be bringing more and more, contagious events into our corrections facilities. And so it worries me to see them move up and everything, because right behind that, you see the inmate numbers pop up. The rental assistance program and the homeowner assistance program are still both available to you. It is absolutely, how in the world could you not take time to just call and see if there's some way you could qualify for some level of assistance that may be able to help you? Just take the time to call us and let us see if we can walk you through it in some way, somehow, get you qualified. And if we can, it'll help you, it'll help all of us in the state of West Virginia and everything, because we want these Fed dollars spent in West Virginia. So nevertheless, check on it. From the standpoint of giving blood, I've said over and over and over how important that is, how vital it is to all of us and everything. Please consider. The Job Jumpstart program is off and going. I told you about the two ladies at the drive-through window and everything, how excited and how proud they were to be back at work. There's a bunch of people that are getting back to work, and this little program has helped a bunch get across the finish line. We want to just absolutely just keep it going and everything, and hopefully we'll drive that unemployment lower, even lower than it is at record after record. So let's just keep pushing that down, keep creating more and more records. That's great stuff. I went to the Coalfield Expressway announcement in Welch the other day. A lot of driving, crisscrossing all the way across the state and everything. And there I'm with Jimmy Riston, and Jimmy's done an incredible job. Honest to Pete, it is amazing what these people are doing. And I could not be more proud of them and everything. And like I said, that end of the world, they need this Coalfield Expressway finished. We've got a bid went out, and the successful bid winner was the Bezak Construction Company out of Lexington, Kentucky. It was a $147,618,000 bid that they put in, and won the bid to build a 5.12 mile section of the Coalfield Expressway from Welch to West Virginia Route 16. And it is just another piece. As we keep piecing it together and everything, we'll eventually get to the end of the rainbow here, and we'll get this thing done. I am totally committed to believing without any doubt the number one most important project in West Virginia is Quarter H. But the number two most important project in my eyes in the state of West Virginia is finish the Coalfield Expressway and bring southern West Virginia into our world, into the entire world. These people deserve it. They've given so much, especially from the standpoint of those great coal miners and their families down there that gave us the energy to power the country, and absolutely gave us the great coal qualities, the great metallurgical coal qualities to make the steel that probably won the wars and everything, that give us everything we have today. And they still are doing it. And so with all of that, we want to help these people, and It is a gigantic priority on my watch, and I am absolutely committed with all in me to do any and everything I can do to get this great highway finished. The only other thing is the ARP money, the American Rescue Plan money, and everything is, the second tranche of that has come in now. We need to be prudent and smart in what we're doing. We just offered up, with the legislature, a $250 million out of the first tranche of ARP monies that was really set aside to do matching grants for water and sewer projects across the state. Now look, when it really boils right down to it, how many water and sewer projects we basically went defunct, and we did very few for a long time. Now we're really after it. Our people deserve absolutely clean drinking water, and absolutely, without any question, our people deserve sewer projects that will absolutely make us better and better. Our people in this great state deserve that. Now, with all of that, we've been so upside down in the decades of the past, and we didn't have any money to turn around. We didn't know what to do, and now we got it going. We got it really, really going. And so with this and everything, we're just going to try to do more and more and more goodness for West Virginia. We're grateful to get another tranche of the ARP money, and the biggest challenge we have, and I think the legislature and I are doing exactly that. Manage it. Run the store the right way. Don't just throw away stuff on pet projects and stuff like that. Manage it and everything, and that's what we're doing. Thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And in support of what the governor has just told us, we do see another surge that is happening both in the United States and also in West Virginia. As we look at the cause of that surge, we see that this is another form of the Omicron variant of COVID-19. As we look at the impact of this Omicron variant, we see that this variant is continuing to change, to mutate, and those mutations allow the virus to escape our immune system more easily. And we also know then that the biggest defense that we have against the new variants of COVID-19, the Omicron variants, and now the BA2 variant, which is what we're seeing in West Virginia. And there's other forms of this variant that we see in the eastern part of the country, which is even more infectious and more resistant to our immune system's antibody effects. So we need to make sure that all West Virginians, as the governor has said, who are in the most highly vulnerable age groups or who are immunocompromised, that you please stay up to date with your vaccines. And we mean that if you haven't had the primary series, please absolutely get the primary series. If you haven't gotten your first booster dose and you're eligible for that, then please get the booster dose. And if you're eligible for a second booster dose, then please get that booster dose, because the more recent that you've gotten your immunizations, the more your immune system can reduce your risk of having not only infection, but serious consequences of infection, like hospitalizations or death. And we know that in the US, we have seen the number of cases go from about 30,000 in March now to well over 100,000 as of last week. And we'll see what we get today in the US. And hospitalizations have also increased about 20%. And in West Virginia, we have seen our R value now go up to 1.16, which means that COVID is definitely spreading. And we also have seen the number of hospitalizations to go up to about 138 with people with COVID, which is still substantially lower than we saw at the very peak of the hospitalizations, but it is concerning that we are seeing people getting infected more readily. Our percent positive rates are going up. And we know that this is most likely an underrepresentation of the true number of people infected because many people aren't getting tested or are testing at home. So in order to help all West Virginians understand when it's time for you to get vaccinated, Jordan, I don't know if you can pull up the demonstration on the vaccine calculator. And what we'd like to point out is that we have created in West Virginia, really through the Joint Interagency Task Force and the Department of Health and Human Resources, the Bureau of Public Health, we've created a vaccine calculator that will help you understand not only when you should be eligible for another dose or a dose of vaccine, but also which vaccine would you most benefit from. And for medical providers, there are new tabs that allow us to help you determine what's the best thing to do for your patients. So I don't know if we have the demo we can run through, Jordan. Good. So the first page that we get when we visit Vaccinate.wv.gov and click on the vaccine calculator is the introductory page. Next slide, please. And then you basically go to next and you come to read the welcome slide. And then this is the slide where you start to make selections. Remember that none of the data that you enter into this calculator is available for any one of the governmental agencies or anybody else. This stays on your web browser and disappears when you're finished with it. So it is very secure and safe for you to use. Next slide, please. So the first then part that you need to introduce is your birth date. And you put in your birth date because we know that there are different recommendations depending on how old you are. And then we'll ask a few other questions. So next slide. And then the next question will be, how many vaccines have you received? And on this one, it would be 1. Next slide. And then we would ask what type of vaccine you've gotten so that we can not only make a recommendation on when it would be good for you to get another vaccine, but which vaccine you should choose. And on this one, it's Pfizer. Next slide. And then as we ask, are you immunocompromised? Because there are clear criteria that are presented by the Centers for Disease Control outlined on this slide to go through to ask, do you have a reason why you should have a different dosing regimen, a different vaccination schedule because you're immunocompromised? In other words, do you take medicines like corticosteroids? Have you had a transplant, et cetera? Do you have HIV? Do you have active cancer? And on this one, we answered no. Next slide. And then it would basically ask when you had your most recent COVID-19 shot so that we can then use the calculator to give you the information about when you should get your next one. And I can't read that at my level, but you put in that date. Next slide. And then you basically find out that you are eligible for another vaccine, and here Pfizer, because that was your first dose on Monday, May 16th, which is today. And then there is an opportunity for you to schedule directly with the vaccination so that you can go get it, which is the second line arrow. And if it's off in the future, you can set a calendar reminder, which is that first arrow where you click on the calendar box, and that will automatically put a reminder on your calendar so that you will be able to get your vaccine at the first opportunity when you're eligible for it. Next slide, please. And then the new finding is not only the type of vaccine to help you understand which vaccine you should get, but this is now for medical providers so that it will make it easier for medical providers to help make those recommendations with you or help you make those recommendations if it's confusing for you. Next slide, please. And this goes through not only the information that you've entered with your medical provider, but also allows the medical provider to get an update on other important elements that they may want to know related to the vaccines. Next slide, please. And then we basically also make sure that if you have any questions, you should call the West Virginia COVID-19 vaccination information line, which is 1-833-734-0965. So this calculator is free to everybody, and we're really excited that people have started to use it. And in addition, as we look at where we are as a state related to our vaccine numbers and look at our booster rates, we see that we are doing better than many states. So that is really a credit to all of you who are really taking that opportunity to check to make sure that you are staying up to date with your vaccines, because we know the most important protection primarily is being up to date with your vaccines. And certainly in people over 50 years old, we also recommend today that you take a bit more precautions when you're in crowded indoor environments, because we know that this new form of COVID-19, this new subvariant of the Omicron variant, is starting to spread not only in the United States much more rapidly, but also in West Virginia. And it really pays to take good care of yourself, because taking good care of yourself takes good care of all of us. Thank you so much.
All right, thank you, Dr. Marsh. Retired Major General Jim Hoyer, Dr. Einam Jad, and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Stephen Adams with Ogden Newspapers.
Hey, this is Steve Adams of Ogden Newspapers. A couple questions here in regards to the ARPA funding. This is the second tranche. Is this the remainder of the $1.35 billion, or are we expecting another tranche further down the road? I know we obviously got the first half, $677 million this time last year. Also, I'm kind of curious, you just talked about the bill that was passed during the special session, putting aside some money specifically for water and sewer infrastructure projects. I know that the ARPA funding allows you to be able to use funding for specific projects such as management, treatment of stormwater, subsurface drainage of water, watershed projects, recycling of wastewater, stormwater, or subsurface drainage water, things of that nature. In light of, for example, what happened here recently in Huntington with their flooding issues, and I know with some of the things that you've said on these briefings talking about the need to do something, will we see some projects coming out of these ARPA funds in regards to flood and storm water mitigation for these communities that constantly have these reoccurring issues? Thank you.
Well, Stephen, your question is long and everything, but let me make as best attempts that I can to, because I love it, because as much information as I could get out there is great. First of all, this is the second tranche of the ARPA money. It's $677 million. We've still got an awful lot, of the first tranche still with us right now. In the first tranche, we made we with the legislature, we put up $250 million in a bucket. Basically, it's going to be used with matching dollars and everything to be able to do sewer and water projects all across our state. Now they got to qualify, and they got to qualify within the terms and conditions of the ARPA bill in its entirety. So we'll have projects that we'll offer up, and we'll walk them through all the different steps and everything, and then see if we can get them qualified and everything, and that'll be how all that works. I guess the biggest thing that you asked at the end was, in the state of West Virginia, rising water with our mountains as steep as they are and everything, without a tremendous amount of rainfall, and our terrain, as horizontal basically as it is in so many different places, with water with nowhere to go, we can get in a situation very, very quickly where all of a sudden, we have a flooding issue wherever. We need to constantly be trying to do projects that diminish or eliminate, the dangers of flooding, because we don't have places for people to build, just limitless level properties and everything. So with all of that, now let's just think about it. In my State of the State addresses, I have said we need to aggressively try to build more lakes and dam control structure throughout West Virginia. Without any question, if we could do that, we would bring more and more folks to this great state. And we are so ripe for being able to build all kinds of incredible, incredible lakes across the state. They don't have to be gigantic lakes, but absolutely they with the greatest waters that we have, you know, not only would they serve a purpose from the standpoint of flood control and recreation and tourism and everything, they could very well serve, you know, power generation from the hydro end of it. And so there's all kinds of possibilities there. We just need to think big. And you know, and so far we're working on those projects, but we've not gotten to where we can really hit home with them. The permitting process is enormous, and it is mind-boggling, and it just shuts you down. But with all of that, there's projects going on, whether it be the Milton flood wall or whatever it may be. There's projects constantly going on to diminish, you know, the possibility of flooding to our people. Now, let me tell you, I was just the other day in Huntington, and I was on Four Pole Creek in Huntington. You know, and it was a few days after the water rose very quickly, and the great residents all around Four Pole Creek were just, you know, many of them, the same memories that I had in the 2016 flood. Thank God we didn't lose all kinds of people, a bunch of people, but it's still, it's terrible. It's all there is to it. To drive by homes where people are gutting their furniture, their belongings, their memories, their photographs and everything, piling them up out in the road in a great big mud-covered pile. Along comes an inloader, loads them up, dumps them in a dump truck, and they take them off to the landfill. All their memories gone in so many ways. And it's really sad. It's just terrible. There's projects everywhere that we can better. And if we have an opportunity here within the dollars that we have to be able to do some of these projects, we need to keep doing them, and we need to keep doing more and more and more. In that situation there, right in the city of Huntington, you know, that situation is going to go on forever if we don't try to find a way to step up through all the vehicles that are available to us today. Whether they be matching funds with the federal government or whatever it may be, we need to be able to continue to step up. We're working on it, Stephen. You know, I don't have any magic wand to absolutely, you know, just say this one's done, this one's done, this one's done. We're working on it. And it takes a lot of layers of passage to get through it, and a lot of red tape, and but we're working on it, but we should be doing it. And I hope that answers your question.
All right, thank you, Stephen. Next to Mark Curtis with Nexstar Media.
Good morning, everyone. Good morning, Governor. I've got two questions. First, and they're completely unrelated. First, if the doctors, Amjad or Marsh or both, want to address why we're seeing this sudden spike or surge, why this is occurring again, and the numbers are going up significantly. But Governor, I want to ask you a political question following up from last week's primary. Have you thought at all, I know you've said that in your terms as governor, you've only met with Congressman Mooney once. Have you thought about inviting him to the governor's mansion or the Capitol for a sit-down meeting and maybe mending fences and trying to get some of West Virginia's priorities in front of our congressional delegation? I know you work well with the other members of the delegation, but it seems to me you have to have good relations with your congressional delegation and all members to get federal aid, to get legislation passed, a whole host of things. And I'm just wondering if it's time maybe to put the bitterness and rivalry behind you guys and march forward with maybe a productive sit-down planning meeting.
Well, Mark, first of all, what on God's earth are you talking about the bitterness and the rivalry? I mean, surely to God above, there's no bitterness or rivalry from my side. You know, I've welcomed Congressman Mooney and will continue to welcome Congressman Mooney at any time. All in the world I have ever said is just this. From a standpoint of my choice in that election, you know, my choice was a fellow that had been doing the work. I mean, that's all there is to it. I am not, there's no bitterness. I mean, for crying out loud, it's, all I'm stating is a simple fact. He's been to see me one time. I'm in communication with Carol Miller. I'm in communication with Congressman McKinley. I'm in communication with Senator Manchin, Senator Capito, all of them all the time. I can't help it that Congressman Mooney has been missing in action. Now with all that, I would absolutely welcome him at any time to come, and I'll reach out again and everything, and to come to the governor's mansion and everything, and we surely absolutely have to have the support of all of our congressional group at all time. There is no bitterness on my side. I don't know where on God's earth you could possibly come up with such a thing as that. I thought the best candidate was Congressman McKinley. He didn't win. That means I work with the other candidate. But the other candidate's got to come to work a little bit in order for me to be able to work with him. I mean, if he's going to hang out in Maryland all the time, it makes it difficult for us to work together. Absolutely, this has nothing to do with, do I like Congressman Mooney? I don't even know the man. Do I like him? Well, I try to love everybody. There is no bitterness. I don't know where you come up with that and everything. But Dr. Amjad and Dr. Marsh, maybe y'all can handle the other question, please.
Sure. Thanks, Governor. Mark, I'll answer some of it and then see if Clay has anything to add. The increase in cases that we're seeing is due to many factors. One, I think it is a natural progression of COVID in the country, and we're seeing that, as well as the drop in some of the masking that people are using. We also are not seeing as many boosters or vaccines being taken up as well. So it's a combination of factors that we're seeing also with travel and the recent, spring break and holidays, people are getting together. But I'll see if Clay wants to add anything more.
Nope, I think you covered it very well, Ian. Thank you.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. This kind of follows up on Mark's second question there. Dr. Marsh, could you expand a little bit on your comments that our COVID numbers are likely underrepresented? How do we know that? I know we're also, doing our wastewater testing around the state. What are the other metrics that we're looking at indicating? Thank you.
Governor, you hear me going?
No, please.
Okay. Thank you. Thank you, Charles. So we know that testing is down around the country, and particularly we know with the increasing numbers of home testing available for people, that many people are either testing at home or perhaps aren't testing at all. So the estimates are that perhaps as many as 1 out of 10 positive cases are being documented at the national level. So we do know that we are likely fairly substantially underrepresenting the number of cases. But as we look at our own data, Charles, we see that our percent positive rate has really gone up pretty quickly. And as I said earlier, the national numbers for what we're capturing have gone up about 3 to 4-fold over the last week. And hospitalizations, particularly in the northeast part of the country, have gone up substantially as well, about 20%. The northeastern part of the country is seeing another version of COVID, the so-called BA.2.12.1, which is more infectious than the BA2 variant. And just to kind of level set this, that we certainly are watching cases, we're watching wastewater, but I think that more and more folks at the CDC and at the White House and others are watching the severity of the outcomes, particularly related to hospitalizations and deaths. And our deaths have still remained pretty flat at about 350 or so a day. And that's not insignificant because that's 350 people losing their lives. And this week, we will likely pass 1 million deaths in the United States for COVID-19. And it's estimated if we had been as aggressive as the best countries in the world with our vaccines, we may be looking at 100,000 deaths instead of 1 million deaths. So we do know that COVID continues to mutate, and new variants are forming. In South Africa, we see the BA4 and BA5 variants, which are very different than the BA2 and the BA2.12.1 variant. So really, what simply this means is the virus is mutating very rapidly. It continues to change and grow stronger. And for us, we really need to keep up. And these new variants are much better at evading our immune systems, which is why they're spreading so rapidly. And in addition, as Dr. Amjad said, some of our mitigation measures, our masking, physical distancing, all that has gone down. So we are at a very, very important inflection point for us, and particularly for older citizens, because COVID is absolutely not over yet. But with up-to-date vaccinations and taking care and testing so that if you are positive, you report that to your healthcare experts so that you could be considered, if you're in those high-risk groups, for treatment with the oral pill Paxlovid or with monoclonal antibodies. These all are life-saving opportunities for us, and it's important that we not let our guard down at this point. So thank you for the question.
You got to come back to me. I got something to add to that. Charles, let me make this simple in Jim Justice's terms. Charles, we have 1,305 new cases in the last 24 hours. Now, Charles, if you'll go back not many months, we didn't have such a thing as a home test kit, did we? We didn't have that. So people had to go somewhere, get a test and everything in order to figure out, if they've got COVID, they don't have COVID, whatever. We didn't have the home test kits, or the home test kits. Now, Charles, if we've got 1,305 new positive cases today, if we've got that many new positive cases right now, how many would we have if we didn't have any home test kits? How many would that be? Would it be 10 times that? Would it be 5 times that? It's surely a bigger number. That's got to concern us. That's all there is to it. It's got to concern us because these numbers have to be underinflated because of the home test kits that we have today that we didn't have before. So with all of that, a number like 1,305 new positive cases in the last 24 hours could really be 5 or 6 or 8,000. So the number absolutely is underinflated. It's the only number we can report because, but the home test kits are having a gigantic bearing on that number. So that's my 2 cents. I think we absolutely need to be on guard all the time. Do as much watching and as much concern as we can. Live our life and manage this. Jordan, I just kind of note we don't have any more questions. Is that correct?
That's right, sir. Back to you.
I guess all I've got to add on top of that, because that's what I was going to end up with, and that's one of the notes that I made and everything. Charles, I go back to this. Nobody's crying wolf here. Nobody needs to do that. Nobody's crying alarm, alarm. Nobody's done that ever. All we've done is just tell you the flat truth. The flat truth is 1,305 new positive cases is a significantly bigger number. But what is absolutely really alarming to me is if we got 1,305 new positive cases with home test kits that we didn't have before, that number could be significantly higher. The only other thing I would say to you is, West Virginia, you've done so good, so good. Thank God we only had 2 deaths to read today. But absolutely, if we will just pay attention to the smartest guy in the room, and that's Dr. Marsh. Dr. Marsh is telling us this is manageable, and we do not have to have deaths. We do not have to have as many hospitalizations and anywhere close to as many deaths if we will just get our vaccines and our booster shots. So with that being said, we know what we got to do, West Virginia. We don't want to let this thing catch us and whiplash around again on us and really hurt us. So thank you so much. That's all I've got.